why should parents be concerned if their children's glasses keep on changing every year?
Oh, wow, Ruan, that is a very good question. So we now know that myopia or short-sightedness is much more significant than just needing ordinary glasses to correct blurry distance vision. We now know that short-sightedness is caused by excessive eye growth. So basically what happens is in childhood, a child's eye is expected to grow at a steady rate until the teenage years. But in a child that is myopic or short-sighted, that eye grows too fast and it continues to grow for too long. And then what happens is that excessive eye growth leads to stretching of the retina. Now, the retina is the light-sensitive layer at the back of the eye that helps us to see. So that excessive eye growth and eye stretching can lead to an increased risk for pathology or eye diseases in later life. And by controlling that prescription or that worsening of a myopia, we can significantly reduce a child's risk for these eye diseases in adulthood.
Herina, what are the risks in the long term if they don't address this at a young age?
So there's a significant increase in the risk for eye diseases such as retinal detachment. A retinal detachment basically happens because that eye is stretched so much so that retina is now not attached properly or as healthy as we would like it to be. It can also increase a child's risk for cataracts in later life and, of course, glaucoma.
And tell me, what does Hoya Optical offer as a solution to this, to the parent?
So Hoya has a very special lens. The lens is called Miyosmart. Now, Miyosmart offers a safe, easy, effective, and non-invasive way to slow down this worsening of myopia or the myopia progression in a child by on average 60%. Now, this lens not only corrects their blurry vision so they can see clearly and comfortably, but it also slows down this worsening and thereby reduces their lifetime risk of eye diseases. And that would be in the long run. In the short run, or the short term, it also comes with benefits such as less frequent changes in the child's prescription, less blurry vision in between eye exams, and then also in the long run, it will reduce the child's risk of ending up with these really thick glasses.
Well, what would you like to tell the parents out there that have children that keep on changing or their eyes get worse every year they see the optometrist? What advice would you like to give them?
I would really urge these parents to ask your optometrist about myopia management and in specific myopia management spectacle lenses. It is really a gift that you can give your child, which when they are an adult, they will be very grateful for. You are still correcting their distance vision so that a child can see clear in the classroom, but you are doing significantly more for them, reducing their risk for these eye diseases in later life.
And what age should they be addressing this issue, or what age should they actually start having an eye test at least?
So, Ruan, the clinical evidence shows that we should start with myopia management at the first onset of myopia. So it's really recommended to take your child for an eye exam before they start school, if not sooner. If there is a family history of myopia, so if mom or dad is myopia, your child is at further risk for developing myopia, and then an eye test would be recommended sooner.
Irina, it sounds like this is like an insurance policy that you're taking out for your children's vision when they're a little bit older, maybe in around 20 there. Unfortunately, you can only measure it then. You won't know until then. And by that time, it's too late because prevention is the cure in this specific case.
Yes, most definitely, Ruan. So evidence shows us that if you can slow down myopia progression by 1 diopter, you reduce a child's lifetime risk of these eye diseases by 58%. So every little bit that we can slow down their myopia in childhood will have significant benefits to this child in adulthood.
Well, that is really amazing. And then a final question: once they've worn these spectacle lenses from Hoya, and they stop wearing them. Does it remain in place or is there regression again?
That is a very good question, Ruan. So the Hoya lens Miyosmart has 6 years of clinical data. And this clinical data shows that should a child, for whichever reason, discontinue with Miyosmart spectacle lenses, there's no rebound effect. In other words, the treatment effect which they achieved while on the spectacle lens, they've banked that, they've got that for life. There's no rebound effect.
Herina from Hoya Optical South Africa, thank you for your time.
Thank you very much, Ruan.